Doctor, what's the vaccine you got this morning, and why did you get it?
I got a dose of Pfizer vaccine. Simply, that's the vaccine that we're using at the healthcare worker clinics. I was asked before, was I going to get AstraZeneca vaccine? I said no, because I have a choice. If I had taken an AstraZeneca vaccine, that would have been a vaccine that somebody 55 to 64 who has no other choice, they wouldn't have been able to use that vaccine. So I'm happy to get either, whatever vaccine's available. This is the vaccine through the healthcare worker clinic that I'm getting, and I'm very happy to get my first dose of vaccine.
What is the trigger or threshold that causes public health to decide when it's time to open up to a new age group?
We really look at it twice a day. We look at the number of, the appointments we have. We really look at the vaccine supply, when the appointments, the people coming in to book when a certain age group is starting to slow down. So we look at that on a daily, if not multiple times a day, and to get a sense of. But we always have to do it within our available vaccine supply.
In light of new cases, what restrictions will be implemented?
Well, we're still in the process. We'll talk more about this at the briefing this afternoon. We're doing an in-depth investigation. We're doing a lot of testing around all these new kind of clusters of cases. We need to wait and see let that play out for the next few days to see what it's telling us and what we may need to do in terms of increasing public health measures. Anything
in particular that is more worrisome to you than other reasons? Like if you have the amount of people in New Brunswick that are catching it and that,
Well, the main thing is we know that we can assume that all the strains we're having are the variant strain. That's across the country. They're more infectious. They spread more easily. What's worrying me right now is we have 3 or 4 little small clusters which we can't readily explain. Like they may be related to travel, but they may be spreading in the community now. So we're just beginning to invest. Sometimes it takes a few days to do the full investigation. We've learned over time that if you investigate, you can put some of the threads together and explain things more clearly. We've ramped up testing, especially we have a nursing home, we have communities, some schools. We're doing a lot of testing around those areas. We'll see over the next couple of days if we get more cases coming from that broad community testing.
When will you be considering lowering of the age range for AstraZeneca?
We'll be talking more about AstraZeneca. Right now, we're waiting for the National Advisory Committee on Immunization. We expect later today they're coming out with their revised guidelines around the use of AstraZeneca. We'll wait to understand what those guidelines are telling us and say and then make a decision about what's appropriate for Nova Scotia. Have to understand that provinces that have lowered the age range have a very different epidemiology. They're in crisis in terms of their spread of COVID. So that's really, we're in a very different position. So we need to understand what NACI's going to say and then apply that to the Nova Scotia context.
PEI has lightened restrictions on the island. What's your thoughts on
that? We're in the process of looking at, for all our public health measures, about what kind of, if you're vaccinated with 1 dose versus 2 doses versus no vaccine. We're looking at how we potentially people who are vaccinated have less restrictions, but we need to do that carefully because the vaccine's not 100%. There is some risk of asymptomatic transmission, and we have the variants around us. So we're working our way through that. Lots of discussions on this at a national level as well.
Getting back to what happened here this morning, how did the shot feel? How was it?
Awesome. I had an awesome nurse. I didn't even feel it at all.
What do you think of the facility?
I was here with the Premier on Friday. I'm so impressed. Not this facility, across the province, where we've got lots of access to vaccine, dedicated expert people running clinics. The logistics we put in place, perhaps people don't really understand what it takes to actually stand up and run a clinic like this very smoothly and effectively. So all the credit goes to all the people from ADM Barbrick, to the people running this clinic, and everybody, the doctors, pharmacists across the province. What an amazing program we have implemented. And people have been saying, well, we're slow, but we have the greatest rate of growth in terms of vaccinating people in the country now. We've taken time to build a very robust, reliable, sustainable program. I'm very confident that at the end of this, we will look back and people will say Nova Scotia had one of the highest quality vaccine programs in the country, because we've taken the time not just to rush to get vaccine out, but to build a program that is quality, reliable for Nova Scotians, and is sustainable. We have to do this for first dose, and then we have to do it again for second dose. So we have to have a sustainable program.
And just for people that maybe not so much worried about the vaccine, but maybe needles, just again tell me like it was, I heard you over there, but just so you could tell me like it was nothing.
It was, I mean, we have to understand that a lot of people are afraid of needles. There are techniques that they can themselves, do to getting support. But people here are immunizing. Are well trained. A lot of the people here are immunized, and the people running the program, they immunize in schools every year. They're used to dealing with people that are afraid of needles. So there's lots of support here to people to get them through that. But also, I think people need to understand that this is important. You need to overcome that and get the support you need, because getting immunized not only will protect you, will protect everybody else around you. And it's critically important at this time, in this third wave with the variants, that we get as many people immunized as possible.
Anything you'd like to add, Doctor?
No, I mean, again, thanks to, I can't say it enough that across the health system, across government, the people are just coming to the table saying, what do I need to do to be part of solving whatever the problem is, whether it's building a vaccine program, a testing program, working behind the scenes to get our digital check-in at the border done. The collaboration and the cooperation and people's dedication for the year plus is just amazing. So I thank everybody that's involved in this.
Thank you.
And how does it make you feel to get the vaccine?
Well, I woke up this morning and I was excited, along with every other Nova Scotian. Now I get a chance to get immunized, and just that feeling of, vaccine is kind of the light at the end of the tunnel. Vaccine gives us all hope. We all need to take advantage of that, but it is exciting to be able to get my first dose and be one more Nova Scotian who now has been developing protection against COVID. And I hope everybody else, when their chance comes, based on their age, when they get an opportunity, come up, take advantage of that and get vaccinated as soon as you're able to.